Hey, welcome to another edition of Dr. Goldstein's blog. I just took a selfie, like everyone does, which brings me to a very important point. Since we've been dealing with a lot of selfies, people have started coming in, looking at themselves and wondering why they're not symmetrical. They just feel their left eyebrow is high, one eye is more open than the other. What's going on is that people are actually looking at themselves more critically than they ever did before. In the old days, before selfies, people would critically look at themselves only after their attention has been drawn to their face, such as with surgery. Now, they're able to see themselves with their selfies, and they think that there's something wrong with them. People come in saying that they're not symmetrical. Well, the answer is none of us are symmetrical. That is just the way life is. Our face is formed from 5 branchial arches that come from the neural crest that forms our brain and comes in the front, and these arches have to meet in the middle. That is an incredible task for them to perform, and it doesn't always work out that well. In the most radical problems, you have what's known as facial clefts. That's the cleft lip, palate, and others that can form when these branches don't come together and fuse the way they're supposed to. But there are normal, mild differences in our face because of this phenomenon. And it actually adds to the character of our face that we're not 100% symmetrical. One side of our face is different from the other, and that is true with everyone you can possibly think of. And next time, critically look at your friend and you'll see what I'm talking about. I'll use an example of this model who you can see a picture of. And this picture, I'm sure, has been already to some degree doctored up before this was put on display. But if you look carefully, you can see her left eyebrow is higher than her right eyebrow. Her left eye is slightly more open than her right eye. Her left lip is slightly bigger. Her left ear actually is lower than her right ear. These are completely normal developments and phenomena. And this occurs just not in her, in everybody else. I have another picture here, and this person's left eyebrow is a little bit higher. Her right upper lip is higher than her left upper lip. Those are completely normal situations. Obviously, there are bizarre changes and extremes. But in the normal individual who is perfectly fine, no two sides are exactly the same. And that's something that I want people to understand and feel comfortable with the fact that they're okay. It makes them much more distinctive. It separates you from someone else because of those differences.